Good morning, everybody. Today we are going to study the anesthesia part. Anesthesia is a very important subject as far as NEET PG or National Exit Test is concerned. About 5 to 7 questions will compulsorily come from this portion of the anesthesia. So let us begin with in anesthesia. The questions are straightforward. So if you are able to solve these questions properly, you will be able to solve the anesthesia question easily and automatically. Let us begin with the session. All are indications for one lung ventilation except. Now, what is one lung ventilation? One lung ventilation, also known as OLV, also called lung isolation, is frequently employed for intrathoracic surgical procedure and also used in situations where pathology may affect one lung but not the other. Lung isolation may be accomplished by a number of methods. What are the different number of methods? Double lumen endotracheal tubes placement, placement of a bronchial blocker through a single lumen endotracheal tube, and single lumen endobronchial tube. Sling three general categories for classification. Now, indications for surgical lung isolation. Number one, surgical exposure. Number two, protection of contralateral lung from injury or pathology. We don't want to disturb the opposite lung. Maintenance of continuous ventilation during differential lung ventilation. For example, bronchopleural fistula. Absolute indications are lung isolation to prevent damage or contamination of healthy lung. Control of distribution ventilation, for example, bronchopleural fistula. Then single lung lavage, as during treatment of pulmonary alveolar proteinosis or cystic fibrosis. Then surgical exposure for video assisted thoracoscopic surgery, that is VATS. Relative indications are thoracic aortic aneurysm, pneumonectomy, lung volume reduction, weak surgical exposure, esophageal surgery, middle and lower lobectomy, mediastinal mass resection, and bilateral sympathectomy. So these are some of the indications, but cardiac surgery is not required. Cardiac surgery does not require one lung ventilation. So all are indications for one lung ventilation except cardiac surgery. Cardiac surgery is a D option. So correct option here is D, cardiac surgery. Let's move on to the next question. All are benefits of supraglottic airway. Now supraglottic airway means LMA, laryngeal mask airway, that is above the glottis, over endotracheal tube, except. Now let us see what are the benefits of supraglottic airway one by one. In fact, endotracheal tube is the best device to prevent aspiration. In case of supraglottic airway or laryngeal mask airway, there is increased incidence of aspiration of gastrointestinal secretions with laryngeal mask airway. This laryngeal mask airway is a supraglottic airway which sits in the hypopharynx. It sits in the hypopharynx and partially protects the larynx from pharyngeal secretion, but not gastric regurgitation. Advantages of supraglottic airway are: it is easy and rapid, it is less invasive, easy and rapid, less invasive, better hemodynamic stability. This supraglottic airway is very useful in difficult intubations. It causes less tooth and laryngeal trauma. This supraglottic airway does not require muscle relaxation. It does not require neck mobility. The disadvantage of supraglottic airway or laryngeal mask airway is increased risk of gastrointestinal aspiration. It is less safe in prone or jackknife position. The airway is less secured, greater risk of gas leak and pollution. It can cause gastric distension. So the correct option here is it prevents aspiration. No, instead it causes aspiration. So it is less invasive, it causes less hemodynamic alteration, it requires less time for insertion. All are correct, except it prevents aspiration. So the correct option here is C. It prevents aspiration. The most frequently reported malfunction in a medical gas line pipeline system are A. Inadequate pressure, B. Cross connection, C. Excessive pressure, D. Alarm dysfunction. Now, the problems with medical gas pipeline system are inadequate pressure is most commonly reported. Other problems are damage during construction projects. Fire can occur. Then there can be a theft of N2O tanks. Environmental problems such as earthquake, lightning, depletion of central supply. Human error can occur. There can be a accidental closure of shut-off valve. Obstruction can occur. It is a pipeline system, so obstruction can occur. It is a pipeline system, so kinking, leak can occur. Then contamination can occur. Obstruction of a hose can occur. So the most commonly reported, most frequently reported malfunction is inadequate pressure. So the correct option here is A. Inadequate pressure. Color of shoulder of oxygen cylinder is. Now this question is often repeated. Color of shoulder of oxygen cylinder is, we all know it is white, and the color of oxygen body is black. So the correct option here is A, white. Massive transfusion of stored blood results in A. Citric acid toxicity, B. Hypokalemia, C. Metabolic acidosis, D. Hypercalcemia. The correct option here is A. Citric acid toxicity. Gene for ryanodine receptor mutation in which is responsible for malignant hyperthermia is located in which chromosome? It is located in chromosome, which chromosome? A. Chromosome 19, B. Chromosome 17, C. Chromosome 18, D. Chromosome 16. So the gene for ryanodine receptor mutation of which is responsible for malignant hyperthermia is located on chromosome number 19. So the correct option here is chromosome 19. First sign of accidental intra-arterial injection of drug. Suppose you are giving a drug, it accidentally goes into the artery. So what will be the sign? They have asked. The sign is pallor. And if they ask about symptom, it is pain. If they ask about symptom, it is pain. So the correct option here is B. Now let us look deeper into this. So the answer is B, pallor. Answer is B. So first sign of accidental intra-arterial injection of drug is pallor. And first symptom of accidental intra-arterial injection of drug is pain. Highest concentration of oxygen is delivered through. Now, highest concentration is delivered through four options are there. A, nasal cannula. Remember, in nasal cannula, only 40% oxygen is delivered. Then Venturi mask, then bag and mask, then mask and reservoir. Bag and mask, 100% is delivered. 100% oxygen is delivered through bag and mask. Nasal cannula, maximum 40%. Venturi mask is maximum 60%. Mask with reservoir, 80%, 80 to 90%. So prob- it is bag and mask. A 20-year-old man was running on the road. He suddenly collapsed. First thing to do is A. Check pulse, B. Chest compression, C. Call for help, D. Scene safety. So whenever such thing happens, what you will do? 20-year-old man was running on the road. He suddenly collapsed. First thing to do is scene safety. First thing that needs to be done on witnessing a cardiac arrest is to verify the scene safety. On ensuring the scene is safety, the victim is checked for responsiveness. If unresponsive, call for help and then check for breathing and pulse simultaneously, taking not more than 10 seconds. If there is no breathing and no pulse, immediately chest compression and rescue breath are started at a ratio of 30 is to 2. So for every 30 chest compression, 2 rescue breath are there. If there is a pulse but no breathing, give 1 rescue breath. Every 5 to 6 seconds or about 10 to 12 breaths per minute. When an automated external defibrillator arrives, the rhythm is checked. If shockable, one shock is administered and CPR is resumed immediately. If shockable, one shock is administered and CPR is resumed immediately. If not shockable, then CPR is resumed immediately. So the correct option here is D, scene safety. A patient with stable atrial fibrillation. Atrial fibrillation, they have asked it is stable. Stable atrial fibrillation. A. IV ibutylide. B. Immediate cardioversion. C. Amiodarone. D. Sotalol. The patient is in atrial fibrillation, but hemodynamic status is normal. So treatment of choice is IV ibutylide. This IV ibutylide is a class 3 antiarrhythmic drug which has rapid onset of action effect in restoring the sinus rhythm. It acts by prolonging the action potential duration and effective refractory period. IV ibutylate is administered at a dose of 1 milligram over 10 minutes if necessary. A second dose can be administered 10 minutes after the first. If there is evidence of hemodynamic deterioration, immediate cardioversion is the treatment of choice. The recommended initial dose for cardioversion is 100 joule to 200 joule if monophasic defibrillator. In a biphasic defibrillator, it is 100 joule to 120 joule. So IV ibutylate is a class 3 antiarrhythmic. It acts by prolonging the effective refractory period and action potential duration. It is administered in a dose of 1 milligram over 10 minutes. Second dose can be administered after 10 minutes. Where should you attempt to perform a pulse check in a child who is anywhere from 1 year to puberty? B. Carotid or femoral. Now, in infants who are less than 1 year, we use the brachial artery. Brachial artery. Whereas from 1 year to puberty, 1 year to puberty, 1 year to puberty, carotid or femoral. So the correct option here is B. Carotid or femoral. Depth of anesthesia can be best assessed by A. Pulse oximeter, B. End-tidal PCO, C. ABG analysis, and D. Bispectral index. The correct option here is D. Bispectral index. Now, most commonly used nerve for neuromuscular monitoring under anesthesia is B. Ulnar nerve. Best site for core temperature monitor during malignant hyperthermia is it is esophagus. So correct option is B. Esophagus. What is the contraindication for ECTs? What is the contraindication for ECT? Contraindication for ECT, electroconvulsive therapy. Absolute contraindication are increased intracranial tension, cerebrovascular response to ECT, including marked increase in cerebral blood flow and blood flow velocity. Cerebral oxygen consumption increases as well. The rapid increase in systemic blood pressure may transiently overwhelm the cerebral autoregulation and may result in increase in intracranial pressure. Therefore, the use of ECT is prohibited in patients with whenever there is a brain tumor is there, known space occupying lesion, or whenever there is an intracranial aneurysm is there. Relative contraindication are recent myocardial infarction, severe hypertension, severe pulmonary disease, retinal detachment is a relative contraindication. Pheochromocytoma is a relative contraindication. So the option correct here is D, cerebral aneurysm. The following are methods of invasive cardiac monitoring. A. Radial artery cannulation. B. Pulmonary pulmonary artery catheterization. C. Transesophageal echocardiography. D. Transthoracic echocardiography. Now, let us look the option one by one. Transesophageal echocardiography is an invasive procedure and could be associated with serious complications like esophageal rupture or mediastinitis. In the presence of esophageal injury or disease. In the absence of esophageal disease, the risk is low. Radial artery cannulation and pulmonary artery catheterization are invasive. Invasive. Transthoracic echocardiography is is minimally invasive form of cardiovascular monitoring. So radial artery cannulation, pulmonary artery catheterization, transesophageal echocardiography, all are invasive procedures. Transthoracic echocardiography is a minimally invasive. Ashner reflex is seen in Ashner reflex means oculocardiac reflex. Ashner reflex is oculocardiac reflex. Ashner reflex is oculocardiac reflex. It is done in squint surgery. Squint surgery. The correct option here is D. All are indications of evoked potential monitoring. A. Cerebral tumor resection, brachial plexus repair, spinal fusion and instrumentation. C. Mastoid surgery. So the correct option here is C. Mastoid surgery. A heavy smoker, when posted for elective surgery, would be most benefited if he stopped smoking. A. 3 to 4 days before surgery. B. 1 to 2 weeks before surgery. C. 2 to 4 weeks before surgery. D. 6 to 8 weeks before surgery. The correct option here is D. 6 to 8 weeks before surgery. 6 to 8 weeks before surgery. Now, what happens in smoking? Now, what are the indications? What happens when the person quits smoking? When the person quits smoking, what happens? I will tell you step by step what happens. In 12 to 24 hours, there is fall in carbon monoxide and nicotine levels in blood. In 48 to 72 hours, carboxyhemoglobin normalizes. In 1 to 2 weeks, there is decreased sputum production. In 4 to 6 weeks, PFT improves. In 6 to 8 weeks, normalization of immune process, decreased post-operative pulmonary complication. So the correct option here is 6 to 8 weeks before surgery. During pulmonary artery catheterization, entry into pulmonary artery is denoted by. When you do pulmonary artery catheterization, it is denoted by increase in diastolic pressure. So the correct option here is C, increase in diastolic pressure. Most common complication of pulmonary artery catheterization. Most common complication of pulmonary artery catheterization is arrhythmia. Correct option is C. Now we will look at the other complications of pulmonary artery catheterization. The complications of pulmonary artery catheterization, most common is arrhythmia, which are usually self-limiting. Sometimes arrhythmia is considered as an indicator of placement of catheter. It is so much common. Other complications of pulmonary artery catheterization are arrhythmias, ventricular fibrillation, right bundle branch block, complete heart block, catheter knots, thromboembolism, pulmonary infection, endocarditis, endocardial damage, cardiac valve injury, pulmonary artery rupture, pulmonary artery pseudoaneurysm. So these are the complications. So most common complication is arrhythmia. So correct option is C. Which among the following is best monitored to detect abnormal hemoglobin? It is definitely CO oximeter. So 22, the correct option is B, CO oximeter. Plasma cooling stage is reduced in all of the following conditions. It is hemolysis. Which of the following is not a complication of succinylcholine? Choline? Water content of soda lime is 15%. So with this, we conclude today's session of anesthesia. I wish you all the best in your preparation. So with this, we have begun today's work. So it will So continuously doing MCQs, more number of MCQs will help you to clear the examination with flying colors, getting a rank and getting a seat of your choice. I wish you all the best.